Hello everyone. Yeah, thank you. Hello everyone. We are on the last day of ICM 2025 in Istanbul and I'm with Dr. Armita Abedi. I want to say welcome.
Thank you very much. Thank you.
Okay, could you please introduce yourself a little bit for our audience?
Sure, my name is Armita and I'm a medical doctor from Denmark. I do residency in orthopedic surgery and currently I'm doing a PhD. Last year, I was the fellow of the ICM, so I worked on some of the aspects for this conference.
Okay. So I want to focus on the infection. So why does the infection matters for you?
Infections, orthopedic infections are devastating. And for many or several of the procedures, such as joint replacements, which are actually meant to elevate the quality of life for patients, it's devastating. Although the occurrence of it is not very frequent, when it happens, it's a very big issue. And my current research, it focuses on how we can prevent this from happening. But the ICM is both the prevention, the treatment, but also the management of infections. So that's why it's very important for me.
You mentioned that the fellowship. So could you please give us for more details?
Yeah, some of the details. Well, so I moved there in 2024, spent most of my time in Philadelphia, and did a few months at the endo clinic in Hamburg. Mm-hmm. I did different research in different areas of orthopedic infections, which was incredibly valuable for me to broaden my perspective. I worked on some of the questions for this meeting and mostly also working on, it's called mesh terms. So this is the way we can retrieve the literature from the databases we have, the medical databases. And that's done in a specific way. So that's what I was working on. So we had those ready for the delegates. How we found the critical or gaps that we needed for the knowledge was by asking all the delegates that are attending to send some questions.
In that point, what ICM means to you?
ICM means a lot to me academically and also as a medical doctor, because we're essentially presenting current evidence on some of the questions that are debated among clinicians. And we're discussing each of the questions and voting to see, is there consensus on which direction we should move toward.
I think this is your first time at the ICM, right?
It's my first time, yes.
Okay. What do you think about it?
I think it's very, very interesting. And the way the sessions are held is incredibly interesting, because usually at conferences, people, or researchers, they present their studies. It takes some time. But here we have 3 minutes to get to the bone of what has been conducted of research. So the turnover is quite fast. And we're all prepared because we've read these documents or have had time to read these documents before we came to the conference.
When you compare to other congress or meetings, what is the difference of ICM?
So the ICM is super focused on, treatment of orthopedic infections. That's the first difference there is, and we're sitting there focused from morning to evening and have to take a state for each question. So that's how it's sort of different, because in the end it does make a difference what agreements are made, because people will be reading these recommendations for years moving on.
As a final question, is there anything you want to say about your thoughts or feelings about ICM?
I'm very positive. I've had a very, very valuable and positive experience both during the fellowship but also during these days.
Okay.
Yeah.
So thank you so much.
Thank you.